We have, as you know how we do our method, but this one is a quick question. So we just, usually we read the last statement, which one should be seen first. So just by seeing first, we know it's a prioritization question. Then we read the rest of the question. And next, receive report of 4 patients. And you have this. Who should you see first? As soon as you see first, immediate intervention, all of them, you tell yourself, I got to be sharp. Now you're sharp and you're focused. You're looking for things that will kill the patient or cause problem. So a client with the back pain and catheterization, usually they will give you 2 things and you have to connect them. Why do you have a back pain and then you have catheterization? That's how you break down the question. Then you think, when they're doing catheterization, they go through your groin and they inject, they put a wire through the aorta, which go all the way to your heart. And then they come out. This puncture site can bleed. The problem, the big portion of the aorta is in your back, retroperitoneum. So when you're bleeding, because it's on the back side, it's retroperitoneum, it doesn't go inside the abdomen, go towards the back. So you have back pain. So back pain in anybody who has cardiac catheterization is bleeding. The same thing if you have an aortic abdominal aneurysm, AAA, or thoracic abdominal aneurysm with the back pain, those are bleeding. So I know this is my B sharp, which is bleeding. Then that is my priority right now. So I'll move to the next one and see what it is. A client with the congestive heart failure and the pink sputum, pink fetal sputum. So 2 things. We have CHF, those are my buzzwords. And the second, these questions demonstrate all the buzzwords. I did it in such a way to include, that was my first video I did. So pink fetal sputum is a buzzword for pulmonary edema. That means there's fluid in your lung. The lung is being soaked with fluid. So you have CHF patient with pulmonary edema. That is patient is having a breathing. It's not an airway issue. It's a breathing problem. So the lung is being soaked with fluid. So they cannot breathe properly. They can bring air into the lung because the trachea, the bronchial are all okay. But then the lung itself, the lung parenchyma. So breathing problem is the lung parenchyma is affected. So they have pulmonary edema. That is pink fetal sputum. That's the buzzword for pulmonary edema. They usually will give you this and you have to figure it out. So now what do I have? I have a bleeding problem. And then I have a I have a breathing problem. So the bleeding problem is a shock here. Okay, so this is my shock. And the breathing problem, yeah, it's breathing. So then I come back and said, a client with tracheal deviation and a JVD with the fall. Okay, after the patient fell, he has tracheal deviation and JVD. Think about it. Tracheal deviation means the trachea has deviated. Therefore, I have airway issue. And I have JVD. Something is pushing the trachea to go to the left. And then I have JVD, which is systemic vascular congestion. There's too much fluid in it. This is what we call tension pneumothorax. There's air going. Probably when a patient fell, it broke the rib, and it has now pneumothorax. Air go inside. Now it's pushing the trachea away. So this is pneumothorax. Now it's a tension pneumothorax. This is an airway now, right? So first one, we have a bleeding, and then we have breathing. Now we have the airway. Then the last one, a client with acute diverticulitis with a white count of 18. So just by looking at it, HIDIS is an infection. Acute diverticulitis with a white count of 18. If you have infection, your white count is going to be high. So it's 18. Fine. We know the patient has infection, so we put this as sepsis. So look at it. You have everything on the B sharp. You have a shock patient, you have an airway, and then you have a breathing problem and a sepsis. So patient who is in sepsis, so this is how you analyze it. If you sepsis we can give you antibiotic and that will take care of it. So I will eliminate this one. Okay. Somebody who is in shock, we have time. We can give him fluid. We can give him some blood to compensate with that before we can figure out. So we do that. If you have a pulmonary edema, this patient may need a laces to take care of it, so we have time. But if I cannot bring air inside, and the P-sharp airway is number one, then this patient has to be number one. It's a tension pneumothorax. You don't have time. It's pushing on the trachea, and they will go. Basically, the heart will stop, and they will collapse because of lack of oxygen coming in. So this is tension pneumothorax. You need to decompress, immediate decompressing as soon as possible. And as you can see, there's some time you can get all these things on the B sharp, but you have to think critically. That's how critical thinking come in. I've CHF with pulmonary edema, and I have a bleeding patient, and I have a sepsis, and I have airway tracheal. But which diagnosis do you think is the problem? I think tracheal deviation with the JVD is more serious than having diverticulitis and infection, which is an expected finding. Bleeding in the rectoperitoneum, there's a lot of space there, so you have time to compensate the patient up, and then this patient can be treated. But if was the only one there with other things, you always have to look at them. So whatever is in the B sharp, it means looking at them twice and saying, this patient is serious, so I have to worry. So I have 4 serious patients. Then you sit back and said, which one should I see? NCLEX will not give you put all these together. I mean, they will just probably use this one alone and give you some small ones that are easy to eliminate. It will give you number 2 and give you other ones you can eliminate, and the same thing as you go. But I just want to demonstrate something that in case you see all these things in the same place, everything is on the B sharp, you don't freak out or you don't worry about it. That, hey, I have options. I have options to step back and now use my critical thinking and just eliminate answers. So it's possible, but usually don't do that. This question is just designed to show you how you can think critically and you can eliminate patients out and cases out from a 4 that is given. So who do we see first? We see the patient with the tracheal deviation and JVD. Like I said, you see me saying ABC. Even though I say ABC, I don't go and look for A and look for B and look for C. And that is what the other method shows. I mean, like you got to put ABC. No, ABC doesn't let you think. You want to look at the problem itself and think about it. What does the patient have? Rather than saying, oh, it's A, B. No, you got to think critically so that when you have a bunch of them that look serious, then you know that, oh, well, I can do ABC. Okay. So that's all I have for you this evening. Take care of yourself, keep charging, and come back again for more. And if you have not subscribed, please do. If you know other person who may benefit from this, invite them to come and share the word. Thank you very much. Bye-bye.